Hello. If you're watching this, it means you either have an emergency shelter program in HMIS or you have a street outreach program in HMIS. Today, we're going to cover the new COVID-19 assessment that is going to be in the workflow for your project starting Friday, March 27th, 2020, around 5 p.m. We're going to talk about what this assessment is going to look like and how it's going to help you. We hope that this very short assessment can help your facility keep track of your client's symptoms throughout this COVID-19 pandemic and therefore keep your facility safer. The goal of this assessment is to help you understand and track who is moving through your shelter so that you can isolate any sick clients if needed. This assessment is less about HUD requiring information from you and more about offering guidance and support during this pandemic. That said, the data that you'll be entering into this assessment can help us find any increases in infected individuals so that we can help communicate that to local public health officials and potentially get you more assistance. If you have a chance, watch the COVID-19 guidance and support video for further information about how to protect yourself, your staff, and your clients during this pandemic. Let's take a quick look at this assessment in the system. The COVID-19 screening assessment can be found in two places within HMIS, inside the workflow and also under your assessments menu. Let's take a look at the assessment inside the workflow first. So here I am, I've started a new intake for my client into my agency's emergency shelter program. I have enrolled both my head of household as well as their son into the program. And the next page that's going to come up is obviously the Universal Data Assessment. I've skipped ahead and filled this out, and you'll notice that once we press save, instead of going to our normal assessment, we are brought to the brand new COVID-19 screening tool. So at the top, you will see a list of symptoms. Take some time to familiarize yourself with the differences between these. The first question asks, do you have a fever? The client can answer yes or no. If so, you can record their temperature. And as you'll see here, you should only record the client's temperature if you have the proper equipment to do so and it's safe for you and the client. If you're using an oral thermometer, you really need to clean it super well before you pass it on to another client. COVID-19 is passed through saliva and mucus, so you can see how it would be very easy to pass the infection on to someone else using a thermometer. They make thermometer sleeves that might be really helpful, but even then, I highly suggest washing that thermometer with a lot of soap and water for at least 20 seconds between uses. If you can, try and get a non-oral thermometer, like maybe an infrared thermometer. That would definitely be a lot safer. Okay. After you've entered your client's temperature, the next question asks, do you have a cough? You can answer yes or no. And then, are you experiencing shortness of breath? Yes or no. As you'll see here, if the client answers yes to questions 1 through 3, they should be masked and isolated. Again, please refer to the other COVID-19 guidance and support video for information on how and where to isolate your clients. The system is also letting us know that if the client answered yes to questions 1 through 3 and are over 55, they should reach out to their local healthcare provider for proper testing protocol. Question 4 is asking, do you have diabetes, heart disease, high blood pressure, lung disease, or any immunosuppressant illnesses? Obviously, these people are more susceptible to COVID-19 and might need special support. If a client answers yes to questions 1 through 3 and has a documented illness for questions 4, please reach out to your local healthcare provider for proper testing protocol. The next question asks for the date that your client's symptoms started. You can enter the date for any client that answered yes to having one or more symptoms. If the client can't remember, you should just enter today's date. If the client is not symptomatic, leave this field blank. And in the comments section, you can write any other information. Scrolling down, you can see that should the client screen positive for these symptoms, it does not mean that they have COVID-19 virus. They could have another type of flu or the common cold. They should be provided with a mask and isolated from other clients. Be advised that the following severe symptoms should be addressed immediately. So you should absolutely call 911 if your client has extremely difficult breathing, so not being able to speak without gasping for air, bluish lips or face, persistent pain or pressure in the chest, severe persistent dizziness or lightheadedness, new confusion or inability to arouse, new seizure or seizures that won't stop. Again, you should call 911 immediately if any of your clients experience any of these severe symptoms. Press save when you're done. And you'll see that you're brought to your next normal assessment. So you can continue on with your workflow from here. I'm going to do this quickly. And you'll see that once we finish our assessments for the head of household, we're then going to be looped into the assessments for the head of household's son. So we're on the Universal Data Assessment page, and just like with the first client, we're going to see the new COVID assessment for each family member as well. It's incredibly important that any client experiencing symptoms have this assessment filled out. Once you're done with the workflow, you can see all of your clients' COVID-19 assessments that you've already filled out by going to your client's COVID-19 screening assessments page, which is under the assessments dropdown of your menu panel. You'll see that we've already filled out one of these assessments for the client. If your client's symptoms change and get worse, that would be the appropriate time for you to add a new COVID-19 screening assessment by clicking this button. Once you click this button, you'll see that you're brought straight to the COVID-19 screening tool page where you can add any new symptoms. Let's say you need to edit an assessment that you already completed. Maybe you wrote down the wrong temperature, or you want to add in a comment that you forgot to write. You can click this Edit Assessment pencil, and you'll see that this is the assessment that we filled out during the workflow, so we can edit or change anything and then press Save. You should disregard this button over here, Add New At Risk of Homelessness Assessment. You'll see that this is for HP and RRH projects only. If you're in an emergency shelter program or street outreach program, this button is the only one that you need to worry about. The idea of having multiple assessments done for a client is that we can map out whether or not their symptoms are getting better or worse. Any other assessments will appear here on this page, and you can easily see what's going on with the client. The expectation is that you'll do this for each client as you intake them into your program. And while it would be a lot to ask of you to do this for each of your clients that are already in your program, we do think it would be a good idea for you to do this with any clients that are experiencing symptoms in your program, whether they're new clients or they've been there for a while. If you have any questions about this assessment, please reach out to us at hmis@thn.org. And if not, I hope that you all are staying safe and healthy, and I'm sure we will see you soon. Thanks for watching.